So they are all welcome to this event that marks the launch in France of the 2020 edition of the Lancet Countdown report. It is a particular year, of course, as the coronavirus highlighted in real time the very deep interconnections between environmental changes and human health. The Lancet Countdown initiative documents specifically the very diverse impacts of climate change for human health. And as the year 2020 is on track to become one of the warmest year ever, if not the warmest, this event focuses on cities and urban health. It is part of the Café Webinaire series of the Centre des Politiques de la Terre, a joint initiative between Université de Paris and Sciences Po. The Centre Virchow-Villermé is part of the Lancet Countdown initiative, and therefore, in my capacity as director of the center, I am particularly happy to be your host for this event, which also highlights the increasing importance of the concept of planetary health for public policies. And I'm also happy to introduce my colleague Charlotte Alpern from Sciences Po, who will be hosting this seminar with me. So we have a fantastic panel today with Samantha Coleman, Professor Robert Barouki, Martin Hendel, and Yann Françoise. And we will start first with Samantha Coleman and Robert Barouki. So please ask your question in the chat, and at the end of these two presentations, we will have a first discussion session. So I will now give the floor to Samantha. Samantha Coleman is the Health Adaptation Research Fellow at the Lancet Countdown, and her work focuses on developing indicators to track both localized and global adaptation to climate change for health. So Samantha, please.
Can you see that okay? Great. Cool. Thank you so much for inviting me to speak, and thank you particularly to Anneliese and Charlotte for organizing this event, and to each of the institutions for hosting this event. And as Anneliese mentioned, the timing of the launch is incredibly important. This year has been dominated by the devastating pandemic that has fundamentally shifted the way each and every one of us conducts our daily lives, and has made more obvious the risk faced by our most vulnerable populations. In just a few days, as I'm sure many of you French women and men are proud to say, we will be celebrating the 5-year anniversary of the adoption of the Paris Agreement. And as has been the case with almost every major event this year, the annual Conference of the Parties, COP26, has been delayed due to COVID-19. A delay in this physical meeting does not mean that there should be a delay in response to the health effects of climate change. In this year's Lancet Countdown report, we focus our message on the joint response to the converging crises of COVID-19 and climate change. In the next few minutes, I will detail the key messages of the 2020 Lancet Countdown report, describe a few of the headline findings, and explain the corresponding indicators and what they mean for France. The Lancet is one of the oldest and arguably the most influential medical journals in the world. It has worked to better understand the links between health and climate change for over 3 decades. The 2015 Lancet Commission on Climate Change and Health concluded that anthropogenic climate change threatens to undermine the past 50 years of gains in public health, and that tackling climate change could be the greatest global health opportunity of the 21st century. Each year since the 2015 Lancet Commission, the Lancet has published the Lancet Countdown annual report, which tracks the world as it moves from climate change as a threat to human health to the response to climate change as an opportunity for human health. The Lancet Countdown is an international multidisciplinary collaboration that draws on the expertise of authors from 38 academic and UN institutions from around the world. We bring together over 120 climate scientists and geographers, mathematicians and physicists, transport and energy experts, development experts, engineers, economists, social and political scientists, and health professionals. The 2020 report has a number of pretty exciting developments. There are new indicators that track heat-related mortality, migration and population displacement, access to urban green space, the health benefits of low carbon diets, the economic cost of extremes of heat and of labor capacity loss, net carbon pricing, and the extent to which the UN Framework Convention on Climate Change, NDCs, engage with public health. Additionally, almost every one of our indicators from the 2019 report has been improved with updated data sets and methods, as well as expanding their geographic and temporal coverage. The findings of the 2020 Lancet Countdown report can be summarized in 3 key messages. First, the 2020 report reveals the worst public health outlook yet. The human symptoms of climate change, including individuals facing extremes of heat, as well as food and water insecurity, have shown concerning and accelerating trends. While these effects are disproportionately distributed amongst the more vulnerable and least polluting countries, no country is immune to the health impacts of climate change. The second key message is that climate change and the COVID-19 pandemic represent simultaneous and converging crises. If we look back to 2019, we can clearly see the influence climate change has had on natural disasters all over the world. This year, major events have occurred concurrently with the pandemic. 2020 has been the most active Atlantic hurricane season on record. I personally had to evacuate from my home twice this summer, while the southern US and majority of Central America was battered by over 30 storms. Governments were faced with the dual problem of how to evacuate communities and provide emergency shelter while ensuring social distancing. At the same time, governments around the world are preparing their economic recovery plans from COVID-19. It is crucial that the forthcoming economic stimulus packages are also green stimulus packages that do not promote further investment in fossil fuels. Otherwise, we will fail to meet the targets laid out in the Paris Agreement. This leads to our final key message from the report. Aligning the global recovery from COVID-19 with climate change will improve public health by creating cleaner air, healthier diets. Investments in a green economy will create a more sustainable economy, and the mitigation of further climate change will protect our natural environment for many generations to come. As countries begin to outline and communicate their NDCs, the time to put them into action is now. I'm now going to move on to detail a few of our indicators and how they support these key messages. As many of you have been living in France or Central Europe for the past few years, one area of increasing concern is heat. Exposure to extremes of heat result in a range of health consequences, including heat stress and heat stroke, worsening heart disease and acute kidney injury, and leads to an increase in all-cause mortality. Populations over 65 are particularly vulnerable to these effects and are being exposed to increasing temperatures around the world. This indicator, which is new to the 2020 report, applies the exposure response function and optimum temperature to the daily maximum temperature exposure of the population older than 65 years to estimate the attributable fraction and thus deaths attributed to heat exposure. From 2000 to 2018, heat-related mortality in people older than 65 years increased by almost 54%. In 2018, reaching almost 300,000 deaths, the majority of which occurred in Japan, Eastern China, Northern India, and Central Europe. In France, there were 8,309 heat-related deaths in the over 65 population in 2018 alone. The average number of heat-related deaths in that same population between 2014 and 2018 was 5,838 deaths a year. This is a 30% increase from the 2000 to 2004 average. Our ability to work is also affected by temperature and humidity, particularly in highly active jobs in agriculture, industry, and manufacturing. Reduced work productivity can have downstream effects on health and economies for individuals and communities. This indicator calculates potential hours of work lost by linking the wet bulb global temperature with the amount of energy typically expended by workers in 4 sectors: agriculture, construction, service, and industry. Across the globe, a potential 302 billion work hours were lost in 2019, which is 103 billion hours more than were lost in 2000. In France, an estimated 57 million potential work hours were lost, a 150% increase since the 1990-1994 average. Shifts in temperature and precipitation impact the suitability for transmission of many infectious diseases. One disease that is particularly relevant to France is dengue. Dengue is a mosquito-borne disease that can cause febrile illnesses and, in severe cases, organ failure and death, with children under 5 particularly at risk. From 1950 to 2018, the global climate suitability for the transmission of dengue increased by 8.9% for Aedes aegypti and 15% for Aedes albopictus. France has seen a whopping 75% increase in the climate suitability for dengue transmission since 1950, largely indicating that France has historically not been very suitable for dengue transmission, but climatic changes have shifted that. So how are we responding and what can be done? The implementation of adaptation and resiliency measures are heavily dependent on regional hazards and underlying population health needs, requiring localized action. This is increasingly being recognized at the city level, where cities are undertaking their own climate change risk or vulnerability assessments. Based on recent assessments, the health impacts of climate change are of increasing concern for cities, with 67% of responding cities in 2019 noting that critical assets or services related to public health would be impacted by climate change, compared with 54% in 2018. 3 cities, Paris, Le Havre, and Nice, responded to a survey to confirm the completion of a climate change risk assessment in 2019. A particular concern expressed by all 3 cities was, again, the risk of extreme heat. An important adaptation metric that can counteract the impacts of extreme heat is the introduction of green space into urban areas. According to the French National Institute of Statistics, nearly 4 out of 5 French people live in urban areas. High density of urban population contributes to the urban heat island effect, which in Europe can cause local temperatures of up to 6 degrees Celsius higher than in surrounding areas, exacerbating health risks for vulnerable populations. The measure of exposure to urban green space is a new indicator for the 2020 report. This indicator uses remote sensing of green vegetation through the satellite-based normalized difference vegetation index, which measures the reflected signature of green plants in the visible red and near infrared parts of the spectrum, and then provides an indicator of the level of green coverage on the Earth's surface. In the 2019 report, we considered a total of 468 urban centers with populations over 1 million. Only 42 or 9% of those urban centers had very high to exceptionally high levels of greenness. Concerningly, 49 urban centers home to more than 156 million people and including 21 capital cities were at the opposite end of the spectrum with very low levels of urban green space. 2 cities, Paris and Lyon, were included in this analysis and on average have moderate urban green space coverage. Alongside green space, building cities and transport systems which encourage cycling and physical activity will help respond to climate change and improve public health. Transitioning to cleaner fuels for road transport will work alongside this to reduce the health impacts of air pollution. This indicator tracks fuel use for road transportation on a per capita basis by fuel type. Although fossil fuels continue to dominate the transportation sector, the use of electricity for road transport rose by 18% from 2016 to 2017, whereas the use of fossil fuels for transport increased by only 1.7%. The global electric vehicle fleet increased to more than 5.1 million vehicles in 2018, an increase of 65% or 2 million additional vehicles since 2017. Based on per capita megajoules of electricity used for road transport, France currently lags behind most European countries, but has plenty of room to grow. Those are all the indicators I have time to present today, so I'd like to conclude by coming back to the 3 key messages I mentioned at the beginning. First, no country is immune from the health impacts of climate change. Unless urgent action is taken, the health impacts of climate change will increasingly threaten lives and livelihoods and compromise the hospitals and clinics we depend on. The COVID-19 pandemic and climate change represents converging crises. We don't have the luxury of tackling one crisis at a time. Aligning the global recovery from COVID-19 with our response to climate change offers a triple win: improve public health, create a sustainable economy, and protect the environment. Thanks again for letting me speak and present today.
Many thanks, Samantha, for this fantastic overview of the results of the Lancet Countdown initiative. So I will now give the floor to Robert Barouki, is professor of biochemistry at Université of Paris and head of the INSERM unit T3S, toxicology, therapeutic targets, cellular signaling, and biomarkers. So Robert, the floor is yours.
Okay, thank you very much. Let me start by sharing my slide. Okay. Okay. Oh, sorry. Let me shift it here. I just. Okay. Okay, thank you very much. So I will be speaking about, the title is The New Challenge for the Physicians, but I will, give a larger presentation based on the HERA project that I am coordinating, and I will tell you more about it. And then based on the exposome concept, give you some feedback on how relevant all this is for different pathologies. So. What is HERA? HERA is actually an H2020 EU-funded coordination and support project which aims at providing the European Commission with a research agenda for the next 10 to 30 years on environment, climate, and health. So it actually addresses research relevant to the Green Deal initiative. Here to the right, you have all the Green Deal initiatives, all the strategies that are developed, and there is up there mentioning that the research and innovation should be also supported. So HERA is trying to provide something about that. So how do we proceed? We have proceeded by identifying key sectors and policy areas, and then engage with stakeholders, with scientists to try to find new ideas, and then develop the agenda based on that. And this is what we call the why methodology, where we have first interacted with many stakeholders, different stakeholders, and identified the knowledge needs, and then also interacted in parallel with scientists and from different sectors, and defined the gaps in knowledge. And then we matched both, and based on this, we identified the major strategic goals that we could identify. And actually, this is just to illustrate what some of our surveys have given. You cannot probably read, either on environmental exposures or on problem-based issues or holistic approaches. And just to tell you, there are a number of different issues that have been raised by stakeholders and scientists, but there are three that have been, the most cited. Maybe there's a bias with the people. I mean, this is not typically a poll, but it's a survey. So, and what you can see is that some areas and issues have been more particularly mentioned by the survey. And these are what we call the 3 C's, which is climate as a major point, chemicals, and cities. These are the 3 C's. But obviously many other issues were also mentioned. I don't want to disregard the others, but those were the 3 most important. That was in February 2020. And guess what? In March 2020, there was another C that added, which was COVID-19. And actually the Commission told us, well, you can still work on what you are doing, but please, can you provide us some information or some strategies for how we could address the COVID-19 and environment issue in terms of research? So we did that anyhow. So these are the main issues. So we developed strategic goals that are summarized, summarized here. The first one is what are the health impacts of environment and climate change? How can we diminish negative environmental exposures? There are not only negative exposure, there are also some positive exposure, but how can we at least diminish the negative exposure? How could we promote healthy livings, for example, in rural area or in cities, urban areas? How can we improve the assessment of health, social, and economic impacts? This is, I think, a very important issue. Support transformative approaches to our lives and develop infrastructures that are needed in the future. I will not develop all these. You can find those in our site, which is heraresearch.eu.eu, twice EU, because we like the EU a lot. Well, they fund us after all. Next slide. Okay, now if you take things from the health endpoint, we mentioned chemicals, we mentioned climate change and cities. If you take this, there are a number of different stressors, and the approach that you would like to take is take a holistic exposome approach to better assess the vulnerabilities and the outcomes. So what is the exposome? The exposome concept has been developed by Chris Wilde maybe 15 years ago, and basically it's the life environmental exposure, all exposures, whether they are chemical, physical, biological, psychological, from prenatal period onwards. So it really includes a number of different processes. This is really a holistic concept, and I would try to show you how it can be useful in different application, at least from the medical point of view. This is, of course, the climate change. You probably all know these reviews, and you have here all the different exposure pathways that are related to climate change, whether they are extreme events, heat, air quality, water quality, food supplies, vector distribution, and the impact on health that is summarized or detailed here, that I do not have really time to detail. So it is complex. There are many different exposures and many different health outcomes related to that. So now if we just take it from the urban point of view, what happened urban, and just as one example why the exposome, which is a holistic approach, is really useful, because the urban exposome is quite complex. You have air, water, food quality, noise, of course, infectious disease, transport, work conditions, psychological stress. All this is, basically the urban exposome, and you really need to maybe focus on the interaction between all these if you want to better understand what the people living in cities are exposed to. And also when you have solutions, and these are a number of different solutions that have been proposed in different settings, these solutions, you have to find how they will influence the full exposome. For example, how one decision can influence air quality, but also maybe healthier living, but also more physical activity, etc., etc. So this is why we think that having this holistic exposome point of view is really useful even for urban behavior. And when you think about climate change and pollution, we believe that it really makes sense to study the interaction between those two. Taken from the physician point of view, you have a number of health outcomes related to environmental pollution and a number of other outcomes that are more or less related, actually. Some are common. Respiratory disease would be common. Cancer is, you have different cancers actually from environmental pollution as compared to climate change. Also, infectious disease may not be exactly the same, and mental illness is a major issue in climate change, but and neurodegenerative and neurobehavioral diseases and pollution. So we have done this comparison, and I think it is quite useful to compare those two, and it really makes sense to try to study in a more integrated way all these issues. Now, let me give you a couple of examples here, and why it's really, when you start from the disease, why is it important to have this interaction between different exposures? For example, in respiratory and cardiovascular disease shown here, you can have, of course, air quality is at the top of the agenda, and air quality depends on a number of factors that are dependent both on pollution and on climate change. For example, the ozone, some organic compounds, particles, other pollutants and whether they are chemicals or biological, all these influence air quality and lead to these respiratory disease. So it makes sense to have a holistic vision. The same for infectious disease, which may be dependent. Well, that's corona was a very good example. Dependent on an agent, infectious agent, may depend on weather, sometimes on heat, maybe in some cases on cold weather, and also on contaminants, which do influence our response to infectious disease and how the severity of the infectious disease. Allergy is also another example, influenced by pollens, by mold, and by other contaminants, which may influence our reaction to these allergens. So we believe that from the health perspective, the effect of climate change are numerous and diverse, and they are also, some of these effects are targeted by other environmental stressors. And we believe that the exposome concept could help us identifying the interaction between these different stressors. And therefore, studying the interaction between these stressors is quite relevant, and the impact on public health action should really integrate all these stressors. Sometimes the combination of even mild exposures can lead to very significant effects. I mean, for example, infection and immunotoxicant at the same time, that would be really devastating. I think we have to address mitigation at different levels and try to do what we can at different levels. And we also believe that the socioeconomic and health status are, both very important to address the vulnerability. And in all cases, we have to address the risk versus benefit balance, and mostly co-benefits when we have to develop some public action to mitigate or remediate some of these negative effects. And with this, I would like to stop here and thank you for listening. I think we cannot hear you, Anneliese.
Thank you very much, Robert, for your presentation. So I don't see any question at the time in the chat, I think. So probably I suggest that we continue and that will give you a few minutes more to ask questions.
Yes, absolutely. And maybe I will take over from here. So good evening to everyone from my end. I'm very happy to have this panel this evening. And as you can see, we've divided the discussion in two different parts. One really focusing on the report and the Lancet's report as such, and then focusing and going down more specifically on the city of Paris and trying to understand also the phenomenon of the urban heat island and trying to focus a bit more on this dimension. So we have two speakers for the second part of the panel. The first speaker will be Martin Hendel, who is assistant professor at the Université de Paris, at ESIEE, and at LIED, which is an interdisciplinary research center. And he will be addressing the issue of urban heat islands and what solutions are there for large cities. So Martin, I give you the floor, and I will then introduce our last panelist after your talk.
Thank you very much. Good evening, everyone. Trust that everyone can hear me. So I'm Martin Hendel. I'll be talking briefly about urban heat islands and heat waves and the need for climate resilience and some of the tools that we've been working on at the Paris Interdisciplinary Energy Research Institute. So just a few words on the team. So we're part of a smaller group within the lab called Urban Climate and Energy, and we focus on urban cooling. And so we work on at different scales. So from the urban material scale in the lab to the city scale with decision support tools that I'll get into at the end of my talk, but only briefly. And so we've been participating over the last few years with a number of partners on different research projects, and we work very closely with different parts and different departments within the city of Paris. So urban heat island. The definition, the textbook definition, is that it's the local heating effect that is observed in cities. So in a city such as Paris, the yearly average difference between the urban center and the rural or natural outskirts is on average about 3 degrees C. So this is a similar order of magnitude that you might find in London or in similar cities across the world. So in winter, we're quite happy to not have to heat our houses and etc. more than we would otherwise. The problem comes and arises during heat waves. So quite a few things were mentioned about heat waves earlier. I won't get into the details any more than what's already been done. Just to give you an idea, so during the 2003 heat wave, which is 15,000 excess deaths in France, and where mortality more than doubled in Paris itself, the urban heat island intensity increased from this average of 3 to the order of magnitude is 10 degrees. So 8 is what we have in this simulation to the right. But 10 degrees is reached quite frequently during the peak heat wave weather conditions. So what causes urban heat islands? There's 4 big categories which are listed here. So we have radiative trapping, which basically consists of once the sun gets into a street, so this is what we call an urban canyon, which is basically a street with 2 buildings on either side. The sunlight that does go into a city street, because of the shape of a city, tends to get more absorbed than if it was just a flat plane. So this is related to this form that we see here with multi-reflections and multi-absorptions. The same problem or the same phenomenon works at night. So when urban materials would be radiating accumulated heat into space or into the sky, because the buildings and materials see less sky because of other building facades, etc. There's more of this emission, re-emission, absorption, reabsorption, reflection stuff going on. So heat accumulates more, is more absorbed for a given reflectivity of materials and takes longer to escape the system via radiation. The other big thing is lack of evapotranspiration. So something was mentioned about green spaces. So green spaces obviously contribute to increased evapotranspiration, which is the phenomenon through which plants and natural grasslands evaporate water. So this is a heat absorbing phenomenon, just like when humans sweat. So the water, as it evaporates, absorbs large amounts of heat, which cools down the area or the system that's in contact with the water that is evaporating. Because cities are much more urbanized and the soils are sealed, etc., there's a lot less water and a lot less vegetation available to do this compared to natural areas. The third one that we bring up quite frequently is wind obstruction. So because we've built all these buildings, well, these buildings are interacting with the pre-existing wind flow, which is slowed down by the presence of these buildings. So this has implications, of course, for air quality, which is deteriorated because ventilation is reduced. But the heat that has accumulated from these other mechanisms is also not transported as quickly or as efficiently away as it may have been in the absence of buildings. And then the final one is anthropogenic heat release, which is just a fancy word for energy use. Any form of energy that is used in a city, whether it be lighting, heating, cooling, driving, any form of industry, all this energy ends up sooner or later in the form of heat. And this heat, because of the density of industrial and human activity, becomes a significant contributor to this urban heat island effect. So what are the responses? Basically, we're going to be addressing each of these items one by one. So you have reflective cities, which historically has implied light-colored facades and roofs. There are modern equivalents to these solutions. This is just a couple screenshots of what you might see in the south of Europe, which I guess is more the vernacular architecture approach to these problems. For the lack of evapotranspiration, as was mentioned in regards to the Lancet Countdown report, we've got urban greening. So the more greening and the more unsealing of soils that can be done, the better in terms of urban cooling effects. A lot of work is done on wind permeability. So how do we favor dominant wind flow during heat spells? A lot of work has been done on this in Hong Kong. This is actually in relation to the previous SARS epidemic in 2002, where they realized that poor airflow between these buildings had a major impact on the spread of the virus then. And so they've been working on it since. And then anything in relation to energy efficiency will improve the anthropogenic heat problem. So another thing you can do so one of the major contributors is air conditioning, because not only are you using energy, which ends up in the form of heat, but you're also taking the heat within your house and you're sharing it with your neighbors. So if you can share it underground or with a river or in a different area than the air, you won't be contributing so much to the urban heat island effect. And something that we've worked quite a bit on, but I won't go into more details than that, is something called pavement watering. You could call this urban transpiration, where you could, so this is Seoul in South Korea, and a number of Asian cities have systems like this, so that's often used for street cleaning, but it can also be used for urban cooling. So say it's a heat wave and you want your city to be sweating, you just push a button and you've got water on your streets, which are, although they're sealed soils and mineral, etc., because they're now wet, they will benefit from the cooling from the evaporation of this water. I'm going to go over for the last few minutes of the talk some of the ongoing work that we do. I obviously don't have time to go into any detail, but I would be more than happy to answer any questions or have a follow-up discussion as you may see fit. So some of the things we've been doing have been focused on urban materials. So we've been studying the performance of pavements or building materials in the lab quite a bit, where obviously there's more leeway for instrumentation and experimental, let's say, creativity, which is not always possible on an existing building or roadway. We've done, as I was saying, a lot of work on this pavement watering technique. So here you have, for example, a infrared image of a watered portion versus a dry portion. Something I do want to bring up is we've been focusing a lot on on pedestrian heat stress. So we're not only focused on air temperature, we're also looking at air humidity, wind speed, and radiative environment, because these are the terms that are going to be affecting the pedestrian heat budget, and those are the ones who have health implications. So that's something we've been working quite a lot on. A few other examples, so we've been working on cool schoolyards for the last few years with the city of Paris within the European ESIEE Oasis project. We've been working on cool materials deployed in cities that also have noise reduction capabilities and other similar things with, so in this case, industry. And finally, to wrap up, we've also been doing a lot of stuff of how do we help decision makers decide where to act first? How do you design urban spaces better based on all the knowledge that we have with this no regrets approach? Because obviously not all the research answers are out there. And so the question is, how do you make choices with this uncertainty without taking too much risk in terms of fallout if what you wanted doesn't work? So what co-benefits can you try and promote while you're at it? And so that's going to be wrapping up my talk. Thanks for listening, and I'm more than happy to answer any questions you may have.
Thank you very much, Martin. And indeed, I can already see that there are quite many questions actually piling up in the Q&R section. So, but maybe I think we may just go through the last presentation and maybe have a joint Q&R session. And I'm very happy to introduce Yann Françoise. I think one of the key aspects of the work we're doing at the Sciences Po Laboratory for interdisciplinary evaluation of public policies is really to bring together research on the one hand and practitioners. And in his capacity as head of climate, energy, and circular economy strategies at the City of Paris, Yann Françoise is certainly one of the key persons to talk to in order to understand how the City of Paris addresses this climate crisis and how it is working together with some of the researchers and different teams in the city and beyond to feed into this thinking that the city is achieving at the moment around climate plans. So Yann, the floor is yours. Thank you very much for being here this evening.
Thank you, Charlotte. Thank you, Anneliese, for your invitation. It's a very pleasure to be here. I have no presentation. I can share some slides after the session if you need about the action of the City of Paris. As you say, it is very important for us, as for me, for example, as practitioner, but for decision makers, for elected people, to have information from the science, and this is very important for the City of Paris. And Mayor Hidalgo repeat regularly that she believed in science. Even in some countries, some people at elective level doesn't believe to science. It's very important for us to share the practice and to coordinate, as Martin shows some examples, the action of the city, and to know if we are in the right way or not in the right way. How our City of Paris is addressing the climate change crisis. It's now not enough, but a long story, because we have 15 years of initiative to try to tackle climate change issues for the city of Paris. Of course, we have a lot of operation, a lot of initiative to mitigate the GHG emission of the city, but most recently, we have now a very holistic adaptation strategy. The first one was adopted by the City Council of Paris in 2015, unanimously by the City Council, after 2 years of a very, very huge study with more than 100 partners from universities, from practitioners, from stakeholders, from also all the economic activity of the city to understand the vulnerability and maybe sometimes the stressness of the city faced to climate change issue now and for the future. It was very, very important knowledge to share everyone. We made these studies in 2012. It was one of the first one in France to help her to build this holistic strategy and not only face to one issue. The previous classic issue for city of Paris or city in France, we said that it's a flood. It's very important to tackle flood, and it's a law, by the law in France, every city must have a flood plan to tackle this issue. But to talk about heat waves' consequences and the consequences of urban heat islands is not in the law. We have to take care by ourselves and to develop the different methods. The first research we found by the city in Paris was in 2007. And this study was very important to understand all, as Martin said, the different, and Robert before, all the different factors that are connected to develop urban heat islands for the city and the consequences for the people, to understand which one are the most vulnerable. They are not the same for the COVID-19. Of course, elder people are very vulnerable faced to urban heat island for the city of Paris, but also all the workers during the day and the babies and so on. So it's very important to understand and to understand the consequences of all the social issues, different level of income for the city. That's new for the city of Paris around the middle of the years 2010s. And now, 5 years after, one of the motto, for example, for the city of Paris and adopted by the city council was that around 2020, we don't want to have any Parisian far away but 7 minutes that close to a cool island. We reversed the sentence. You talk about urban heat island, we talk about how to develop cool islands within the city boundaries. But the first thing that's to design, what does it mean, a cool island for a city? And we work with a lot of people from Météo France, from Santé, Publique France, sorry, it's in French, the French Institute in France, to design. What does it mean? It's a place when you can rest during maybe 1-2 hours to gather your energy, to be under the shadow, but a place where you are sure it's cooler than in the road or in your flat. Because in the flat in Paris, when there is a long heat wave, you have the temperature that increase every day, and it's very, very hard to sleep during the night, and so you have some troubles and health issues. So that's a really important thing. And one of the, of course, classic cool islands for the city of Paris is to develop public gardens, but public gardens with shadows. Public gardens also with lawn, but not, I would say, yellow lawn during the summer, but green lawn. And sometimes it is very complicated to explain to citizens that we must put water during the summer when we have constraint of water for the lawn to have the evapotranspiration during the night and the effect benefit for the city of Paris. So it's a very long dialogue to have the citizens to explain the good reflex and also to adapt the city. So now we have quite 1,000 cool islands within the city boundaries. Of course, as Martin said, we want to develop more and more cool islands where we need it and to have no regret. So to develop more public space garden. But now we have a new program to develop more and more green areas and to rethink the road. Must we have a waterproof city? It was the definition of the city at the beginning of the last century. We are engineers, I am engineers, and we develop waterproof cities. But now we try to develop sponge cities, permeable cities, to keep sometimes the water when it's possible with all the networks behind, but also to decrease the effect of urban heat islands, to have more and more green cities, thermal species, to change the color maybe sometimes on some, asphalt and so on, and to protect the citizen from the reflective materials from the buildings. It's a new way of thinking. And of course, if we can plant trees, it will be very, very useful. But sometimes we have to wait for 10, 20 years to have the good shadow from the trees. So now we develop a catalog of new urbanism, new tools for the decision makers to adapt the city, to refresh and cool the cities. But it's not only one solution. And for such a dense city, it's quite a surgery, road by road, district by district, to choose a good one. And when you can't, for example, plant a tree, you can change the asphalt and so on. Maybe you can put some temporary shadows, like in some cities from Barcelona, Lisbon, and so on, during the street, and to finally have a new way of thinking the way for pedestrians. It's very important. But it's very important to give the information to the citizens. It's why now we develop an app for the information of any citizens where you can find good islands, how to have the good reflex. It's the main challenge for the city of Paris. Of course, we have also other challenge faced to adaptation, but for the next 10 years, we are quite sure that the temperature of the city of Paris will maybe +3 degrees by 2030. Currently, if we compare to the last centuries, the beginning of the pre-industrial era, we are at +2.1 degrees for the city of Paris already. 1.5 is maybe for the global planet, but for the city of Paris, we are already at 2.1. So the consequences for the citizens are very, very important, and is the main challenge for us.
Very much, Yann, for this presentation, and for bringing in this input from a city perspective and what you are developing, and also to show how the perspective on management of water, for example, has changed and shifted over the course of the century, especially in a city like Paris. So I think we have a number of questions that arrived in the chat. So Anneliese and I are going to split and to address them to the different speakers. I think I'm going to start maybe for a question to both Yann and Samantha, which is a question about how to build coalitions to support and making pressure towards spending more expensive programs and coping with pavements, retrofitting, pavement watering, but more generally, I think to create large coalition for making pressure about urban heat islands and the impact of climate change on heat. So this is maybe one question for both of you, coming from different perspectives, of course. I guess for Yann, it would be how to build support among the population, and building support also among the administration and among business actors to raise and develop some funding for this particular kind of issue. Maybe for Samantha, this is also part of the work that the Lancet Countdown is doing. And maybe a second question, which I will address to Martin, which has to do with impact of the solutions that you described on car traffic, which is one of the questions that came also in the chat, and trying to see how this would impact mobility, I guess, more generally, and maybe contribute to reducing traffic would be a solution to that. So it's a personal opinion. So yeah, Samantha, I don't know which of you would like to start, and then Martin.
You can start if you would. Samantha, it's okay?
Sure.
Okay. So the first question is very important, and it's a great question. But my first question, finally, is why to spend more? Because one of the key issue for this very, very dynamic transition and important transition that we have to make is to shift the million for maybe city of Paris, but the trillion for the earth, to this new economy. And when we spend €1 to put asphalt on the road, maybe we have first the question: should we put asphalt, or maybe another system? Asphalt costs a lot, and if you replace by sand, for example, when you don't need asphalt because you can be permeable, it's not the same. Of course, after you have all the costs for the railing, to be sure, to the maintenance, to integrate. The other thing, as it was said before, public money is rare, and so when you can invest €1 for mitigation, it will be good. It will be benefit also for adaptation. One of the key issues for us, for example, is how to retrofit the stock of building of City of Paris with outside thermal insulation. If you can put outside thermal insulation, of course, you decrease your energy demand for the winter, and you decrease your needs of cooling from your buildings. But we are in very aesthetic architecture cities, and it's sometimes very, very difficult to put outside thermal insulation. And so architects say, no, we can put inside. But if you put inside for the summer, it's not good, because you will keep the heat in the buildings. It's good for the winter, but not for the summer. And so after that, you pay more money to cool, and maybe you have development of aircon. And so if you have aircon, you have more GHG emissions, and so on. So it's not good. So we have to take care of how to invest correctly to have good benefits from mitigation and adaptation. And of course, you're right. We have to find funding for the private retrofitting, not obligatory, mandatory for the city funding, because for public initiative, we can fund it. And currently, for example, the public money is very low rate on the market, so it's very quite easy. Don't say that the mayor, but it's quite easy and cheap. But now one of our role is to make private investor confident to private initiative, to finance private initiative in our own territory, because we are not the only one to act, and we want to act for citizens, for companies, and so on. That's the main deal: how to shift the trend to the private initiative.
Thank you very much, Samantha. Do you want to comment also on how to raise attention and raise support, and maybe coalitions, not just in the city, but maybe globally, which is what the Lancet is doing with this initiative?
Sure, I can talk to that from the perspective of which we're approaching it at the Lancet Countdown. We have much more of a global reach, and we are also a group of mostly health professionals, but as was obvious by everyone's presentation, the issue of climate change is deeply interdisciplinary. And so how do we get momentum behind the issues, or how do we identify the most important issues and then get momentum behind that? And the approach we've taken at the Lancet Countdown is to utilize the public trust in health professionals and medical institutions. And people trust doctors. And so when you have doctors and medical professionals saying this is a problem, it can create more general trust in the public that this is an issue. Coming from the United States, where I think, Yann, you mentioned that some places in the world struggle with believing in the science. We're still working on that here. And so, having someone who everyone can trust and say, this is the issue is a starting bound. And then I think someone asked about reports and things being available. If you go on the Lancet Countdown's website, lancetcountdown.org, you can access the 2020 report, but you can also access, we have done a whole bunch of country level policy briefs. And the goal with those is to identify, those were all developed with local partners, and the goal with those is to identify local issues that are really important to that country, take things from the global report and bring them down to the country level, so that we can synthesize in just a few things what policymakers need to hear and what decision makers need to hear, and things that will really get them motivated and driven to make change. Go ahead, Yann.
If you can add one word, what we need maybe from practitioner decision makers is a connection, of course, with health and health consequences on the cost of non-adaptation, or maybe to spend too more time to adapt. We have seen with this current crisis, because maybe we decrease all the care about public hospitals and so on. We pay a lot now of money, but maybe if we can assess correctly the consequences on health of the non-adaptation or the late of adaptation, it will be very, very useful for decision maker for the decision, maybe to spend a little bit more money now, but not in 10 years, because in 10 years, €1 will cost maybe €1,000. And things that now people are more aware to listen to those information that maybe 1 year ago.
Yeah, that's a great point. And then also the question of, do funds get allocated to adaptation measures or mitigation measures? What needs to be taken care of now proactively, and what needs to be planned for in the future? And how do we allocate money in the right directions? Because there are many ways that money can be spent, and how do we identify what are the most important issues?
I guess this leaves us with the key question of implementation, right? It's always good to have a beautiful plan and a strategy to go ahead, but then it's always about policy implementation, which is absolutely key to every policy, really. And maybe Martin, you want to comment maybe on this question about the impact on car traffic from the materials you worked on, and then Anneliese will be raising to Robert Barouki a few questions that came into the chat to continue the discussion.
Yeah, thanks. So I did try to give some part of an answer to in the Q&A platform. It's a tough question. The difficulty with the urban climate is that what's relevant to pedestrians is actually the urban microclimate. So everybody knows that when it's hot and it's a heat wave, if you cross the street from the sunny side to the shady side, you're not as hot. The thing is that spatial scale is counted in meters. So like maybe 5, maybe 10. So what's true at one end of those 10 meters may not be true at the other end. So this is also true for the impact of car traffic. So very locally, if anybody who's been to New York knows that when you cross the street on Broadway, in front of all those stopped at the red light taxis and other things, you're melting. It's horrible. So you know there's an impact. But the thing is, when you're across the street from that, it's mixed in with all the rest. So it's very hard to isolate that specific impact. At the urban scale, car traffic and even anthropogenic heat is it's one factor out of plenty of others. So it's like maybe 10% max of what we're seeing is going to be that in terms of energy. Now, if you're sitting in front of the car that's venting all that heat into you, that's a lot. But if you're in your house, it's a different story. So it really, really, really depends on the very specific local characteristics of what area you're targeting. So as such, car traffic is not on the top of my list, at least not off what I've got on my mind right now or offhand in terms of what we should be targeting. There's plenty of reasons to work on it for other stuff, air quality, noise. There's plenty of reasons, health, because people exercise more or whatever. I'm not sure it's a big thing for urban heat, but except for these very specific situations. I mean, if you're sitting in front of a bus, the place where all the buses end up at the last stop, and maybe it's a big deal. But as I was saying, it's very local. So it really, really, really depends on the specifics of the urban space you're targeting.
Thank you, Martin. So we received 3 questions addressed to you, Robert. Mm-hmm. The first one questions the concept of exposome. Is the exposome really relevant for complex and collective hazard? The extension of the risk factor epidemiologic notion. So what is about something that extends through culture, representation, mistakes, self-deception, for example. The second question is more about environmental justice. So the evidence shows that in cities, the poorest people and communities tend to live in the most polluted environments. And are therefore much more vulnerable to negative health outcomes. So do we have concrete example of the application of the exposome approach, combining socioeconomic and environmental factors in the cities? And the last question is addressed by a physician. So what concrete actions are you expecting from a physician on their daily practice, as prevention seems key, but have you any other recommendation?
Okay, thank you. Thank you for all these are very important and difficult questions. But okay, concerning the exposome, it is actually meant for that. It is meant to integrate, complex issues. Now, this, exposome was developed by Chris Wilde, as I said, who was at the IARC at that time. And some people say it's the wild concept. It's really a wild concept. It's too much. I mean, it's too holistic. So I think you have to be very pragmatic when you are doing exposome. And I think the importance of exposome is that it brings you to do things, in a very pragmatic way and define the issues. For example, if you have to know better the exposures, and sometimes you don't really know the exposure. Let me give you a small example. You can have, for example, exposure to particles because we have an average particle in Paris, and that gives you an idea about the particle. But if you have a detector at home, then you can see maybe sometimes different things. I mean, if you dust, if you cook, if you smoke, I mean, you can see the particles increasing dramatically in-house. I mean, and that's really where you are exposed. I mean, it's much better than the really average. So it is really improving how to measure the exposures. It attempts to integrate all exposure, but you have to do it progressively and in a very pragmatic way. If you can integrate, more exposure than what you do usually, that's fine. And then when you have very complex things, you may miss something. But we are getting there. I think it's on the road to getting there. So we shouldn't expect too much, but we shouldn't, we should go into that direction. That's my vision of the exposure. Very pragmatic to start with. Concerning environmental justice, that's a very important, as you all know, you know these things probably better than I do. And I'm thinking about I'm thinking about the study that Denise Meroux did in Paris, because we remain in Paris, and he compared different areas of Paris where there's heavy traffic, like the Ring, the Périphérique, and the Champs-Élysées. I mean, both have a reasonable amount of traffic, but socioeconomically they are extremely different, in some areas of the Périphérique and Champs-Élysées. And what he showed was that the mortality more or less related to air pollution is higher in the areas where the socioeconomic level is lower. There are plenty of biases. I mean, people do not eat the same way, they probably do not exercise the same way, etc. I mean, there are many biases, but still, I mean, this is what we showed. And things have been done, also studies on, for example, COVID-19 mortality in the US, where you have differences based on socioeconomic status, which seems to be different in India. I mean, it's not the same in India. So I don't know how to, there are many ways also of interpreting this, but it's really important to integrate these issues and to think about these socioeconomic factors. Now, on the physician side, this is one of the challenges that actually I feel I have, because as an MD, I feel that exposome should at one point be useful for the physician. It's not so easy, but to do that. But it's basically maybe interrogating patients a little bit more than we usually do, and not considering that there is one factor that leads to one disease. And there may be different factors that should be integrated. If you have somebody with a heart condition, for example, well, you have to ask this person about where is he living and how bad is the air quality where he's living. But you have also to ask about noise, because noise is now clearly correlated with heart disease. And this was not, you can ask about lead in the area, because lead is now more connected. So if you have a vision of the exposome, you may ask more questions and try to give advice for prevention. I mean, the aim is obviously prevention at this level. You can have, give advice of prevention in a more, general way or holistic way than just one factor, one disease, which is not really, something that we still believe in nowadays. I hope this addresses to a certain extent, but I think we should not over, emphasize it. We have to be very pragmatic with the exposome and see that it's leading us to do more things, to do more exposure studies, and to integrate more things. And if we can do that to start with, that's already something in practice that is okay.
Maybe, thank you very much to all of you for answering these questions. I guess one of the question I wanted to ask all of you, because at some point in your talk, you've mentioned issues related to the role of cities, to data, to the fact that we were looking at a complex and an interdisciplinary phenomenon. So relating to the way we do research and how we understand this complex phenomenon. So I guess one of the question, maybe to finish this panel and to give an opportunity for each one of you to address and to answer it, would be to ask you maybe first, how do we think about this urban heat phenomenon on the one hand at the urban scale? So this is maybe for Martin and for Yann. We know a lot of cities are struggling about this at the moment in Europe. I can see some colleagues from an H20 projects that are connected right now from Antwerp or from Greater Manchester, which we are working together with exactly on this particular issue. And we know this is not something easy. So how do we think at the urban scale? If you know, car use, Martin, you said it's not on the top list of your priorities. Someone asked, you know, so what is on the top of your priorities? Particular question. I think you had it coming in a sense, but that's with this statement. But I guess this question is also for Yann Françoise. And then if we raise this issue back to Robert and to Samantha, how do we bring together the research that is currently being done on health on the one hand, and on the other hand, on a territorial scale, because this also raises a number of key issues. And Robert showed a graph about this, showing all the different phenomena to be taken into account. And Samantha mentioned the fact that Lancet Countdown have been trying to reach out to cities as a new kind of stakeholders in this report. So maybe to speak a little bit and address the issues of the methodology would be super interesting, I guess, for the public that we have this evening and our audience. Maybe Samantha, you would like to start, and then we can go in the same order of the speakers this evening.
Sure. So my focus is mostly adaptation. And when we think about adaptation, what's difficult when we write the annual report is that it's a global report. And adaptation by nature is localized. It's very dependent on the local population, the resources in that population, and the ability of that local government or system to cope, or what kind of resources they have available. So when we think about prioritizing different adaptation or mitigation measures, the way that we like to think about it in the health community is first identifying who are your most vulnerable populations. What we've seen with both COVID and with climate change is that the most vulnerable populations are being outsizely affected, and they should have, and we're seeing this question now as we figure out how we're going to distribute the COVID vaccines. Do we give them to the frontline workers first? Do we give them to older populations first? And that same approach can be taken with adaptation and mitigation measures that says, yes, there are things that we know that reduce urban heat island effects, but do they reduce those effects for the populations that are most vulnerable to them, right? So trying to say, first doing an assessment that says who are our populations that are being most affected, our older populations, but who else? And then trying to prioritize all of those actions by addressing those underlying vulnerabilities first.
Thank you for this very clear answer from the Lancet. And Robert, maybe coming back to Hera.
Yeah, well, I mean, it's I would have said also about, you know, that vulnerability is probably one of the most important issues, taking it from the health side. I mean, that's, and now, but I think taking it from the health side, the other important issue that I already mentioned, but I think we still have to consider, is that I think the inquiry should be larger than what we usually do. I mean, it's not absolutely, I don't think that all, you know, the physicians ask all the right questions, you know, all the time. If they know more about the influence of different, you know, stressors, maybe they would ask more questions, and maybe they would, you know, give an advice. Maybe people have to change, you know, the place where they live, or to change their mode, you know, their behavior, or their, you know, food, or whatever. I mean, because we know that many different exposures and stressors may interact to lead to a certain health condition. So I think the inquiry should be much larger, and the advice should be much larger than what is usually done. And that's I think something that we could really do. I mean, for example, we know, I mean, as I said, if you have a heart condition, and we know that heat is not so good, noise is not so good, the food you eat, you know, the diet that you have may be more or less good. The sedentarity is not so, I mean, there are different issues. So you have to give a more global advice because we have to play on all these stressors. We are not absolutely sure what is the most important one.
So it's a good transition to Martin. So what is on the top of your list if car use isn't? I think this is.
So the short answer is there's nothing on the top of any list, because something that I usually take time to get into, but I didn't have time today, is urban heat and urban heat stress for pedestrians is very, very, very micro scale. So as I was saying, crossing the street from the shady side to the sunny side makes, everyone knows, a world of a difference. Walking in front of these cars stopped at a red light makes a difference. When the area that you're targeting is being used also matters. If you're targeting a schoolyard, which is used during the day, obviously you need to create shading devices, because you don't want, or at least there needs to be shade available, because obviously if it's just a void and it's just a desert from that perspective, then that's obviously not good. If you're targeting an area where there's lots of restaurants that are filled for dinner with terraces outdoors, there's no sun, so it's not going to be shading. It really depends on the goal and the target time frame and population. So what was being said about vulnerability was interesting, because we've worked on this issue, but there's also a question of what will be effective where. So as I was saying, the example of shading for an area that's used at night is pretty self-explanatory. So you need to verify that the physics of the tools you intend to use match with the physical configuration of the space you're targeting. It's very hard. It's very hard to give a succinct answer, because it's a very complex issue. There's a lot of research that's still ongoing. There's a lot of things we still don't know. So this no regrets approach is kind of important, and there's no single fix. So there's no one size fits all. I'm sorry. And some things that work great for urban heat will be disastrous for air pollution. So, or among other things. So you do need to keep an eye out on these things. And there's a holistic, interdisciplinary, multidisciplinary approach is definitely fundamental when we're dealing with urban areas, because there's different things going on that are conflicting or not conflicting that need to be addressed at the same time. So it's hard to, there's nothing on the top of a list, to be short.
That's a conclusion that I, as a political scientist, usually not really working in the same line, could very well be happy with, in terms of, there is no size fits it all, and but the general way to ask questions and to look at things could be a good way to start, and then to
maybe the top of the list is get familiar with your local scientists on the issue. That's the
exactly. So Yann, maybe this is your turf. If we start talking about this particular side of things, getting familiar with the issue in Paris.
Yeah, of course, we have to facilitate the connection between research and practitioner and decision makers. But of course, the top of the priority for mayor of Paris is to protect the citizens, to protect the most vulnerable ones. And so it's very important, so first, to explain the condition of the development of urban islands, the consequences of the behavior and so on. We talk about or the conference about, for us, infrastructure, but the behavior is very important. The social issue is very important, and sometimes it's very hard to make people understand the consequences of such an act and so, as said Robert, it's a holistic and global. You talk about how you eat every day for your health, of course, but also for your GHG emissions. Is important too, and you have, and as citizen, you can act on your global emission, on your strategy of your country, finally. So we have to explain everything, and it's why maybe you have heard Mayor Hidalgo decided to create for next year the Climate Academy, to explain to young children, to maybe students, because it's for 9 to 25 years, what is important to take care of climate change issues, and for helping people to have good decisions in their next life as decision makers or as citizens. but it's to protect everyone. And maybe one word is very important for us is solidarity. Solidarity between all the decisions, solidarity with the citizens, but also, as you said, solidarity with other cities, because if there is a domain where you have a lot of connection between the city, is how to tackle your bad heat islands. I'm a member of a lot of cities network, and is each cities network, you have a cool cities network, non-urban heat island network, and so on. Last week, I exchanged with Phoenix. Compared to Phoenix, we are natural cool cities because it's so hot compared to Phoenix, but we exchange what we did, and maybe it will be useful for us, and so on. We are we have very motivated colleagues in Barcelona, Athens, Lisbon, and we learn from each other. And of course, because maybe we are in a group of practitioners, we can share our fails too. It doesn't work. Why maybe it doesn't work? Because there is social behavior to adapt, maybe because it's too expensive for us, or maybe it was not the good time or the good techniques. And it's very important because we have very few years to act. And so if we can share, of course, our successes, but it's most at the political level, and we can share our fails very honestly, we can win time, and maybe we can save people and save lives. It's very, very important for us.
So I think it's a plea to continue this kind of dialogue and discussions. I would like to thank you all, Samantha Coleman from the Lancet Countdown initiative, Robert Barouki and Martin Hendel from the Université de Paris, Yann Françoise from the City of Paris, and I'd like to thank you on behalf of Anneliese, Depoux, and myself, and we also like to thank teams from the Centre des Politiques de la Terre, the LIEP at Sciences Po, the Centre Virchow-Villermé, Santé, Publique, Paris and Berlin to help us and to support us to host this webinar. And it was organized in partnership with the Lancet Countdown and with the Centre National de l'Ordre des Médecins. I have no idea how to translate this in English, and I haven't tried to do it on the top of my head. Sorry about that. But I think it shows that we're trying to launch an initiative to bring together different perspectives to think about the impact of climate change on health and urban health more specifically. And I hope we'll have more opportunities in the future to pursue this conversation. Thank you very much this evening, and thank you also for the audience for participating and raising different questions to our participants. Thanks a lot. Good evening.
Thank you. Thank you.